All right, let's jump right in. We're going to take a look inside the incredible world of modern orthopedics. You can almost think of it as a kind of specialized engineering, but for the most amazing structure there is, your own body's framework. Your bones, your joints, your muscles, all of it.
But here's the thing. What happens when that framework needs a little help? It's a question that, honestly, most of us are going to face at some point. Because when the very structure that carries you through life starts to act up, well, it affects absolutely everything.
Maybe for you, it starts small. That kind of nagging, persistent ache in your knee or your shoulder that just doesn't go away. And suddenly, the simplest movements become a real chore. Or maybe it's not gradual at all. Maybe it's sudden. That one wrong twist on the field, that one awkward landing, and bam, you're sidelined. And for anyone who loves to be active, that is just so frustrating. And then, of course, there's back pain. So common, and it can feel totally debilitating. But here's the good news I want you to hear. For all of these issues, there is a clear, modern path to getting you back on your feet.
So, where does that path begin? Well, it all starts with a conversation. This isn't about being told what to do. It's a modern, patient-centered approach where your journey, your story is front and center from the very beginning.
And this really gets to the heart of what modern care is all about. It's a true partnership. It means that your goals are what drive every decision. It means you've got a whole team of different experts working together for you. And it means having access to the whole spectrum of solutions, all built on the absolute latest in medical science.
So how does that actually work in practice? Well, first, it's all about diagnosis, getting to the real root cause of the problem. Then, you and your team collaborate, talking through every single option on the table. From there, you build a plan that is 100% tailored to you. And the support doesn't just stop when the treatment is over, it's there for the long haul.
Now, this brings me to a really common myth I want to bust. A lot of people hear orthopedics and immediately think surgery. But the reality? The journey almost always starts down the non-surgical path first.
And believe me, this non-surgical toolkit is incredibly powerful. We're talking about things like highly targeted physical therapy, medication programs, advanced image-guided injections, and supportive bracing. All of it is designed to give you relief and stability. And a lot of the time, it's all you need.
Just look at something like PRP injections. This is a perfect example of modern conservative care. It's a total game changer in how we think about healing. Instead of just putting something external in, this therapy actually harnesses your body's own incredible healing powers. We're literally taking platelets from your own blood, concentrating them, and using them to supercharge the healing process and fight inflammation right where it's happening. How cool is that? So you get to this kind of fork in the road. And the key thing to remember is that the non-surgical path is always the first one we explore. It's only if those really powerful conservative treatments aren't getting you where you need to be that the conversation even begins to turn toward surgery.
So, okay, what happens when that non-surgical path just isn't enough? Well, that's when we look at advanced surgical solutions. And modern surgery isn't what you might picture. It's precise, it's effective, and often it's minimally invasive. It's about finding the right tool to fix the underlying problem for good.
Take arthroscopic surgery, for instance. Instead of a big incision, the surgeon uses a camera that's absolutely tiny, it's called an arthroscope, and these very small instruments to work right inside the joint. It's how they can go in and expertly repair really common things, like a torn ACL or rotator cuff damage.
And what does that mean for you, the patient? Well, the benefits are just huge. Because it's so much less invasive, you're looking at minimal scarring, way less pain, and a much shorter recovery time. The goal is to get you back to your life faster.
And the range of what can be done surgically is just incredible. You can see here, joint replacements are a big part of it, but there's this whole spectrum of expertise. There's specialized care for sports injuries, complex spine issues, trauma and fractures, and even dedicated orthopedic care just for kids.
But here's the thing. Whether your path was surgical or non-surgical, the journey is not over. In fact, you could argue the most important part is just getting started, and that's the road to recovery.
This quote really just says it all, doesn't it? The real measure of success, the whole point of everything we've talked about, isn't the procedure itself. The real goal is getting you back to living the life you love without being held back by pain.
And that is why rehab and physical therapy are so unbelievably important. This is where the magic really happens. It's the active part of your recovery where, with the help of experts, you rebuild that strength, you get back your flexibility, and just as important, you restore your confidence in what your body can do.
So in the end, that's what modern orthopedics is truly about, unlocking your potential and just tearing down barriers. It really leaves us with a powerful question to think about. What could you do? What could you achieve if movement was no longer a limitation?